Hello and welcome to the Integrative Health Convention 2018 online interviews. Today we're going to find out more about clean language with Nick Pohl, who's speaking at the Integrative Health Convention this October at the Park Plaza, Victoria. The Integrative Health Convention is an annual convention in London featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through various healing practices. It's an opportunity for doctors, therapists, and the public to meet, share, learn from, and connect with each other. At the Integrative Health Convention, we believe that true health is holistic and that people get better in more than just one way, and that we all have so much to learn from each other. The Integrative Health Convention provides a stage for this for therapists, for doctors, and the public. There are a limited number of tickets available, which can be purchased at www.integrativehealthconvention.co.uk, and I'll put the link below. This series of online interviews will help people get to know our speakers who are leaders in the different fields of healing and therapy or medicine, and maybe help you decide which talk to attend out of the 36 talks to choose from over 2 days at the Integrative Health Convention in 2018. I'm your host, Dr. Wong. I've been a GP for the last 12 years in Devon, and I'm co-founder of Neurolinguistic Healthcare Limited, the organizers of the Integrative Health Convention. Neurolinguistic Healthcare provides courses in advanced communication skills and therapeutic techniques, as well as training in hypnosis for healthcare professionals and providers. So today, I'm speaking to one of our excellent speakers who's coming to the 2018 Integrative Health Convention on the 13th and 14th of October at the Park Plaza, Victoria in London, to share with you what he knows and to tell us about who he is and what he does and what to expect from his talk at the convention this October. And this is Nick Pohl, who is a shiatsu mind-body therapist and an author who's written a book, Words That Touch, which is a book about the use of clean language in therapy.
Body work.
And body work. That's right, body. That's right. And he does courses in mindfulness and numerous other mind-body workshops. So if you, and I'll put his details below. So Nick, hi.
Hi, To. Good to talk to you.
Good to talk to you. It's great. And thanks for coming to the convention to speak to us in October. Yeah. Shall we begin by letting the audience know a little bit more about yourself and maybe what I didn't cover?
Yeah, I just wanted to say that how inspired I was to see that you had the courage and the confidence and the vision to put together something like this, where you're actually inviting people from Western medicine and complementary therapy to get together on equal terms. Traditionally, complementary therapies, of course, have had much lower status than Western medicine, on equal terms, and listen to each other. Because it resonated so much for me, because I run a group here in London called the London Mindful Practitioners Group, and it's for people, professionals, mainly health professionals, who use mindfulness in their work with clients and patients and so on. Quite a few of our members are in the NHS, like clinical psychologists and so on. But the whole purpose of our group is to use the principles of mindfulness, the sense of being able to sit with yourself in an embodied, comfortable way and listen with curiosity, non-judgment, acceptance, openness to other people. So we create for ourselves a kind of forum like that, where we commit to using these principles of mindfulness to listen to each other, to learn from each other. Because even in the field of mindfulness, there are many tribes, and some of them don't necessarily understand others. But it really works for us. So I'm really inspired and curious to see what's going to happen when we meet at the convention in October.
Brilliant. Because it sounds exactly like what we're trying to do. Just get everyone talking and in a non-judgmental way, and looking at each other as equals.
Yeah.
And so tell me, what exactly does your field involve?
Well, my field involves a couple of things, 3 things. My field involves what I started training with originally with one of your other interviewees, Clifford Andrews, In shiatsu, the Japanese art of healing through touch, which is based on the same principles of qi, of energy medicine, as acupuncture. I then got into clean language, NLP and clean language. Clean language is a way of asking incredibly simple questions which help people to explore their own internal goings on, their own sort of subjective inner landscape. And I just found it worked really well with the body work, with the shiatsu. But I loved it, but not everybody. When I started trying to teach courses, not everybody did. And eventually, I started training formally in mindfulness, and I found that mindfulness, bringing those simple principles I mentioned, and the embodiment of one's presence, bringing mindfulness to that helped just make the clean language and the energy work fit together so perfectly that that's what I now do with clients and in courses.
Wonderful. I love mindfulness because it's really taken off with so much evidence base behind it now. And one would think, after thousands of years, someone would have thought that it actually did work. And there are podcasts by Professor Mark Williams in Oxford, who's the professor of psychology there, isn't he? And he wrote.
He's a retired professor of psychiatry, and I did some of my training with him, and he is one of the most inspirational figures in the field.
Yeah, amazing. And he talks on his podcasts about how he didn't believe it worked until they went on these courses and then started seeing all these changes.
Absolutely. There's a whole story in there about how, as he says, how these Western professors of psychiatry got it into their heads to go and try and study mindfulness. It's fascinating when you hear him tell those stories. But a whole story of how clinical the clinical mindset meets the traditional Eastern wisdom.
That's right. Yeah. And it's all about just being open and trying it.
Yeah.
So I'm always curious what brings someone like yourself to be interested in their field. So in what you do, and can you tell me how you got interested in what you do and the story behind how you started doing what you're doing now?
Yeah, no, there's a personal story here, which is like my dad was an academic, and he was a historian, and he, like most dads of his generation, he wasn't much good at being around as a dad, and I think I kind of grew up thinking that the only way to relate to the world was through my head, and I went to Cambridge University and I studied history. And then I thought, this history is great, but it seems to be, one story after another. What are the principles behind all this weird and wacky human behavior that makes up the stories? And so I switched to social sciences, social and political sciences, to try and find out what the patterns were. And there, immediately, in the same university, I found myself in a completely different culture. It was a culture of people who thought they were doing science. They were looking at human behavior through statistics. And being terrible at statistics, I didn't really get very far. But I found, I got to see another side. And at the same time, I got to see there are two sides, and I'm still not getting what I want. So rather like Cliff Andrews was saying, I started getting interested in Eastern approaches, Eastern philosophy, and the real wisdom that in the Taoist approach and the things like the 5 elements of seeing things systemically. It's not just ancient wisdom, as they say. It's actually very, very modern approach to see things systemically. We wouldn't be able to have weather forecasts if we didn't have gigantic computers that can see the whole system of weather around the planet and make forecasts. But that's really what Chinese medicine has always tried to do. It looks at patterns and it tries to make diagnosis, prognosis, forecasts. So that's in terms of what was going on for me. I then got into shiatsu in a big way, And
Mhm.
shiatsu is about body work. You don't talk. My Japanese teacher didn't think about, he didn't like to talk at all during the sessions he gave me. Very Japanese approach. Um, and that was fine for me. And I think my dad was even okay with it. He was curious about what I was doing. Um, but eventually I started to feel this kind of tap on my shoulder, and it was language. I felt I wasn't being completely me, just working, just working silently with touch and with energy. And I thought about this, and I realized that the way that my dad connected with us as children was through language. He loved poetry. He loved the ambiguities of psychoanalysis, for example. He was really interested in psychoanalysis. He loved
Mm.
Shakespeare. And the rhythms and the tonality and the musicality of language was somehow profoundly embedded in my sense of myself.
Mm.
And that's when I discovered uh, NLP and clean language. That there's a simple, very, very simple way that we can ask our clients questions which help them to connect with their embodied sense of themselves, yeah, or help them to communicate with a symptom rather than them just lying down and relying on us to sort them out, you know. So bringing this mindful step in, um, encouraging our clients and our patients to develop a more mindful relationship with their own body, their own energy system, if you think that way, and so on. So for me, it was a putting together of those two things. And as I said, mindfulness, learning mindfulness as I did, studying it um, at the Oxford school there, um, helped me put all of that together in a way that seems to really work now.
Amazing. So you were going to talk about clean language in October
Yeah.
and tell us a bit more about it. Maybe you can tell us a bit more about what the audience will gain out of your talk.
Yes. What, uh, what I thought would be a good idea, especially in a convention like this, coming back to my dad, growing up in an academic family, I got I got sort of embedded in me the idea that academic uh, conventions, conferences were pretty masculine, ego-ridden events where you
Mhm.
had to establish your male territory and show that
Yeah.
you got the best theory and people would be attacking you. I didn't like the idea of that at all. So I think as we're moving into a more femininely sensitive uh, age, uh, it would be good if I could use my workshop as a forum, rather like the mindfulness group, where I will introduce some of the principles of clean language. I'll
Mhm.
introduce us to some ways to be together with mindfulness and to listen to each other.
Mhm.
And then we will run with it. We will have that time to actually see what happens when we make connection with ourselves. Why are we here? What has brought us here to this potentially amazing event? Uh,
Mhm.
and then get a sense of ourselves as a group also, maybe. What does this group know about why it is here? These are things you can access rather excitingly when you start asking the right questions in in the right kind of state.
I think we'll definitely get a lot out of that, actually. And
You.
I,
Um,
but I really hope that when people do come to the convention, they won't be um, full of ego, and they will be curious
oh
and
yes,
find out about everything. And I'm
oh
sure.
yes, absolutely. This won't be like an old-fashioned academic convention, but you know, we're all there as practitioners to get something for ourselves. We're there to sell our books, to sell our courses. That's fine, but that's the sort of the left brain competitive side of human nature. This right brain side, which, you know, this is something I talk about in my book quite a bit, based on the work of Ian McGilchrist, the retired psychiatrist, and Alan Shaw, the psychoanalytical psychotherapist. um, how they how they think about the two sides of the brain, and how they basically wanting us to do different things. But the verbal mind, the one that kind of runs our everyday life, the managerial mind, tends to live in the left side of the brain. I don't think many neuroscientists would dispute that. Whereas the right side of the brain, which is the one which is much more connects much more easily with those mindful principles of being in the moment, being in the here and now, being alert and aware of what's actually happening now, rather than going back into the past or worrying about the future, those things. That side of the brain is actually the side which is much more intimately connected with the body, with the information flowing from the internal organs, the heart, the gut, up into the brain. And that side doesn't actually have words. So as human beings, we're stuck in this duality of having our sensations, our felt sense coming up into our awareness, not easy to put words to them, and then this other side of us, which has all the words, but doesn't really like to get into the emotions unless it can put a label on them. So when you use clean language, you're inviting those two sides of the mind, two sides of the body mind, to connect with each other, to listen to each other. And that's when the healing starts to happen, I think.
Sure. So I'm asking one more question, which you may have answered already, but as a teacher or therapist with years of experience, what do you think in particular is the key to healing in what you do? So I'm looking for something personal as to what you do and you think that makes the most difference.
Well, the first word that comes to mind for me personally is patience. I'm a very patient guy. If I have a client who comes and just talks and talks and talks, my strategy is just to listen until eventually something comes up from that right side of the brain, which is connecting with the body. Because a lot of the time, the left side will just talk and talk to avoid an issue, to avoid a real sensation. So patience is one of the things for me, but I completely respect people who are impatient. They can sometimes come up with good ways, but essentially, patience. There's a lovely quote from the Tao Te Ching. Do you have the courage to wait for the mud to settle and the right action to emerge? And I think that's the bottom line for me is patience to wait until things settle, until all that busy everyday mind stuff settles. And then not to attach myself to the idea that I need to come up with a good idea, a diagnosis, but to be open to what kind of information is emerging from this field of connection between us. And I think that's the other key word for me is meeting. It's just waiting to meet this other person, for me and them to meet at whatever level, the deepest possible level, and then knowing there's something that is being asked for, some kind of intervention seems to be right. And then proceeding in a collaborative way, checking that what I think is right for them, and moving along in that way with some shared understanding of what we're doing, some shared intention of what we're aiming to achieve. That's it.
It really resonates with me. Thank you.
Okay.
That's absolutely fascinating. I would love to attend your talk. There are 36 different ones to attend, and hopefully this will help our audience who've been watching all this time try to figure out if they will attend yours. And we've had so many amazing speakers. It'd be difficult for everyone, I'm sure. So thank you for taking the time, Nick, and thank you for all the audience for listening to this interview. So remember, everyone, to get your tickets early from our website. Unfortunately, they are limited, and you can follow the links below. We are the Integrative Health Convention in London on the 13th and 14th of October 2018. You can use the discount code podcast10, which will give you a 10% discount as a gift from us to you for sharing your time with us today. So, when we see you in October in London, you can get to meet Nick, myself, and all our other amazing speakers who will be sharing so much with you then. So thank you very much, Nick.
Yeah, do come along. I think it will be amazing. See you there.